You're packing a small hospital bag the night before surgery. Socks, phone charger, lip balm, and a question you're almost embarrassed to ask. If hospitals are getting safer, why does one calm bedside question still matter so much when you're lying under those warmed blankets? Softly, because infection prevention is mostly a hospital system job, but patients and caregivers can help catch the moments where risk quietly changes. CDC's current data pages estimate about 1 in 38 hospital patients has at least one healthcare-associated infection on any given day. CDC's 2024 report says acute care hospitals improved from 2023. Central line infections fell 9%, catheter urinary infections 10%, MRSA bloodstream infections 7%, and hospital-onset C. diff 11%. The progress was uneven. Abdominal hysterectomy surgical site infections increased 8%, so the story is real improvement, not a reason to stop paying attention. So today is not about policing nurses, blaming doctors, or pretending a patient can run infection control from a pillow. CDC puts it plainly: patients, caregivers, and healthcare providers all play a role in patient safety. That means shared work, not shifted responsibility. A good question doesn't accuse anyone. It slows the room down for 10 seconds and invites the care team to confirm the plan out loud. Many people stay quiet because they don't want to be difficult. That fear is understandable, especially when you're tired, medicated, or scared. Here is the bedside script: 5 polite questions for surgery, IV lines, urinary catheters, discharge, and symptoms that show up at home. Before surgery, CDC advises patients to understand their infection risks and wound care plan, including what to do before leaving the hospital. Question 1. Before surgery, ask, does diabetes, smoking, medication, allergies, or skin preparation change my infection risk, and should I avoid shaving the area? This question works because surgical site risk is not one thing. Blood sugar, skin irritation, allergies, and timing can all change the prevention plan. CDC specifically advises patients not to shave near the surgical site because tiny skin breaks can create more places for germs to enter. If you know you'll be groggy, consider asking a caregiver to write the question down and ask it with you. Surgery day can blur. You may remember the parking garage, the gown, and then almost nothing until someone offers ice chips. That's why the question belongs before the procedure, when your mind is clearer and the team can still adjust preparation details. For central lines, CDC says bloodstream infections can happen when germs enter through the line into the blood. Question 2. Before you touch my line or dressing, would you mind cleaning your hands again? And how long does this line need to stay in? CDC tells patients with urinary or central line catheters to ask daily when they can be removed. For lines, you can also avoid touching tubing or the place where it enters the skin as much as possible. This is not a cleanliness test for one nurse. It is a routine safety pause around a device that bypasses normal skin barriers. A gentle tone helps. I know you're juggling a lot. Could we do hand cleaning before the line care starts? For urinary catheters, CDC says longer catheter use is the most important risk factor for catheter-associated urinary tract infection. Question 3. Is this catheter still needed today, and what is the plan to remove it safely? If the answer is yes, consider asking what you can do to keep it flowing properly without pulling, twisting, or touching it. Device removal is a balance. Sometimes a catheter is needed. Sometimes yesterday's necessary device becomes today's avoidable risk. The question may help the team reassess timing, but it does not prove removal is always safer for every patient. Then comes discharge, the moment when everything suddenly becomes yours. Wound care, medication timing, phone numbers, and a body that feels unfamiliar. Question 4. Can you show me exactly how to care for the wound, line, or catheter? What antibiotics I'm taking and why, and who I call? CDC advises patients to understand wound care before leaving and to know which symptoms should prompt a call. CDC says antibiotics treat certain bacterial infections, not viral infections, and side effects can include diarrhea and C. diff. So ask, What infection is this antibiotic meant to treat? How long should I take it? And what side effects mean I should call? Do not stop or change an antibiotic on your own. Consider asking the prescribing clinician if problems appear or instructions feel confusing. Use teachback. Say, I want to make sure I've got this right. Can I show you how I'll do it at home? Home is where small symptoms can feel ambiguous. Is this normal healing, a medication side effect, or something that needs attention? After surgery, CDC says to call a healthcare provider immediately for fever, increasing redness or pain, or drainage from the surgical site. For C. diff, CDC advises contacting a healthcare professional for diarrhea while taking antibiotics or after finishing them. While noting not all diarrhea is C. diff. Question 5. I'm home after hospital care and I have these symptoms. Based on the timing, should I be seen today? Describe what changed, when it started, and what you were told to watch for. You do not have to diagnose yourself. Pause. Some symptoms deserve urgency: confusion, severe weakness, trouble breathing, clammy skin, or a fever with feeling suddenly much worse. In that situation, consider asking directly, could this be sepsis, and where should we go right now? If symptoms feel severe or rapidly worse, skip the perfect script and seek urgent help through local emergency services or your healthcare team. Notice the boundary. These questions do not make infection prevention your burden. They help you participate without replacing trained clinicians. CDC's 2023 Hospital Prevalence Survey found 2.6% of hospitalized patients had one or more HAIs, with patients 27% less likely than in the 2015 survey. The declines do not prove patient questions caused them. They point to better systems, surveillance, prevention bundles, and persistent work by care teams. Your question fits inside that system. It is a small checkpoint, not a substitute for protocols, training, staffing, or infection control leadership. If you're worried about sounding rude, lead with appreciation and ask for help understanding the plan. Try this. I know you're taking care of many people. Could you help me understand whether this line is still needed today? That sentence is polite, specific, and grounded in safety. It asks for expertise instead of challenging someone's competence. If you're too groggy, the system still should protect you. A caregiver can simply add another layer of memory. Before admission, consider choosing one person to hear instructions. Ask the 5 questions and repeat the answers back later. You can keep the questions in your phone, but make sure the screen has no private details visible to others. If you are alone, ask the nurse to repeat key steps slowly and watch you demonstrate what you understood. You might say, I learned better by doing. Can we go through this once before I leave? CDC even offers hand hygiene wording. Before you start the exam, would you mind cleaning your hands again? That wording matters. It is brief, respectful, and normalizes hand cleaning as part of care rather than a personal criticism. The hardest part may be the first time you say it. Most safety habits feel awkward before they feel ordinary. Practice once out loud before you go. Your voice will recognize the sentence when the room feels busy. Recap question 1. Before surgery, what changes my infection risk, and should I avoid shaving the area? Question 2. Before line care, could you clean your hands again? And how long does this line stay in? Question 3. Is the urinary catheter still needed today? And what is the safe removal plan? Question 4. Before discharge, show me wound or device care. Explain antibiotics and tell me exactly who to call. Question 5. At home, these symptoms appeared at this time. Should I be seen today, and could this be sepsis? Healthcare-associated infections include problems like central line bloodstream infections, catheter urinary infections, surgical site infections, C. diff, and hospital-onset MRSA bloodstream infections. Because each risk has a different pathway, one vague question is weaker than 5 specific checkpoints. If you are immunocompromised, have complex wounds, or take immune-suppressing medicine, consider discussing a more detailed prevention plan with your clinician. This content is for informational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider before making changes to your health routine. Warmly, if this helps you feel calmer before care, consider liking or subscribing so more patients find evidence-based scripts without scare tactics. So, if hospitals are safer, why ask? Because progress reduces risk. It does not remove the need for clear communication. Keep the script simple. Why is this device needed? When can it come out? What signs matter? Who do I call? And could this be sepsis? You do not have to be loud to be safer. Sometimes the most powerful thing you bring to the bedside is one calm question.